beard, man. That looks
The grays are
solid,
coming in.
bro. Jeez.
Thank you, man. I appreciate it.
So what's going down? Have a seat for me.
Yes. So I noticed when I'm working out, I get this pain right up in here.
Okay.
And it's bad. And like even sitting down, coming over here, if I'm sitting too long and I'm trying to sit with a straight back,
For sure.
it just starts to it burns. Like right now it's kind of burning.
Is it just on the left side or the right side?
Just
too?
on my left. Yeah.
Do you have any shoulder problems?
Not that I know of. No, nothing hurt. Oh, actually, there is like a pop in one of these arms. I think this is right.
That one?
Yeah.
Any numbness and tingling that shoots down the arm, hand, leg, or feet?
Not that I can recall.
Cool, man. Dude, I was excited for you to come through today.
Appreciate that, man.
Yeah, man. I was talking to the guy like goes on social media.
Yeah.
Oh man, my boy's coming in.
Yeah.
He's like, I'm gonna follow him too.
Oh, that's awesome, man. Thank you. What does that do?
That's to check if anything is pinching onto your spinal cord in the neck region. So, very important, bro. Good. Let me see. Painful?
Oh yeah.
That's your norm, or so we think.
Dang.
Relax everything here. That's not too painful, right?
No.
Good. Thumbs down for me. Push up really hard. Hard. Good. Good. Relax everything here. Painful?
Nope.
Good. Thumbs down for me. Push up really hard. Huh. Push up really hard. Push up really hard. Do you feel like it's a little bit weaker on the left?
Yeah, absolutely.
And most of the pain that you feel is here?
Yes, sir. Right there.
The shoulder blade, huh?
Dang, that hurts.
Yeah, dude, you got a lot of stuff in the arm. This is what's happening too. That it looks like you're having the beginning stages, or even possibly chronic impingement syndrome of the rotator cuff. That can be from an old injury. So because you have pinching of that rotator cuff here, the supraspinatus, which is the actual muscle that shoots right through here and gets pinched, you start compensating a lot here and it runs its way down too. So you have abnormal muscle like activation all throughout the rear rotator cuff, which is part of the reason why you have pain here.
Yeah.
And here. Yeah.
That's a bad one.
You know what I mean?
Yeah.
All right, so that's what we're gonna do. I'm gonna break up all that scar tissue and adhesion buildup that you've developed throughout the years, back here and here. In the rear rotator cuff, we're gonna do a lot of manual muscle work.
Okay.
I'm gonna drop some mean elbows, dude, the people's elbow. You know what I mean? And then I'm gonna get you adjusted. I'm gonna get you aligned, all right?
Okay, perfect.
Perfect. You ready for this?
I'm not, but let's do it.
A lot of muscle compensation, more muscular development here. And this one seems a little bit more normal, but this one's bulgy right here. And that's exactly where it hurts. All along the left side, right, my man?
Yes.
I can tell you're a sloucher because this is the thing. You have the apex of your curvature,
Yeah.
big time. You can tell right here, man. You can tell also that you're a fighter. Like you do MMA and stuff. Your stance.
I used to train a little bit. So is that loosening it up?
Yeah, I'm just getting you loosened up first, man. Just start off slow.
Alright.
How does this whole thing feel when you're working in front of a computer all day?
Painful.
Painful.
Painful. And I'll notice I'm slouching too, but it just kind of relieves the pain.
Yeah. You feel all those knots in there?
Yep.
Yeah, so what I'm going through is I'm scraping all the adhesions that you have built up in there that have developed through the form of compensation. I mean, once your body is being placed in a position that's forced to adapt to, for example, sitting in front of a computer and slouching for 10, 12, 14 hours a day, at that point your muscles start to compensate. One muscle starts to pull you this way, the other one the other way. and you have abnormal muscle firing patterns, you start developing knots and adhesions. That's all this that you have right here, right? So what I'm doing right now is breaking it up manually, and although it hurts, it helps because it's breaking it up. You'll get more flexibility within your muscle tissue. More flexibility means more movement. More movement means more pain, less pain, and being able to be active and working out without it having to bother you. Makes sense?
Yes.
Do you do any form of training currently?
Mostly just at home. I'll do some free weights.
Okay.
And some ab work. I think the ab work really hurts my back.
For sure.
Yeah.
The low back or the upper back?
Kind of both.
Yeah. This is the issue too, that I have a lot of patients who have herniated discs in the low back. A herniated disc is a little spongy thing, and bulges back and it strikes a nerve. Once you strike a nerve, it shoots down the butt and thigh and lower leg. And they're like, man, why can't I do crunches? Why can't I do abs? And the fact of the matter is that the more that you do flexion, the more pressure that you place on that balloon, also known as a disc, that makes it bulge even further backwards. So, gotta be mindful.
I go for a sit-up and it hurts bad right here.
Yeah. So, and that's I mean, not to say that sit-ups are bad, but they're just not the workout for you at the moment, right? You want to make sure we stabilize that. You all right, brother?
Yes, sir.
I know this sucks, man. I'm sorry.
It's all right. Thank you.
Dude, I'm about to knock down a mean elbow on you.
Oh, shoot.
I like to call this the people's elbow.
Let's go, Rob.
You remember that?
That's right.
What I want to do is I want to loosen up all the tension that you have built up here from all that constant sitting, right? And sometimes the good old-fashioned way is the best. Good. And just bear with me, man. I know that this hurts, but if it feels like too much, please let me know. Oh, there's a lot of stuff going on in there, though. Good.
Ooh.
You okay?
Ooh, a little bit.
When was the last time you had some work done, brother?
Years.
Bro, you're running on fumes right now.
That's right.
I need to mobilize this. This is the rear rotator cuff. It oftentimes compensates. It tightens up a lot when you have dysfunction along the front part, which is part of what you have too. So I'm going to have to loosen it up to give it more mobility so it doesn't hurt you or bother you as much, especially when you're doing push-ups, pull-ups and things like that.
So should I lay off the working out?
I think that you should lay off of the push press for now and the overhead pressing. Recuperate the front and strengthen and rehab the rotator cuff, which is back here, and part of it from the front too. Oh shoot! All right, brother. I'm going to give you a spinal alignment. Okay, we're gonna pop some bones in here that have been abnormally placed. Okay, give me a deep breath in, all the way out. Good job. Relax the right end to the left. You're gonna hear some cracks and pops. Good. Give me one more. All the way out. Good job. I'm gonna push here. Bear with me. Good. One more. Good. Relax everything here. Good. Whew. You okay?
Oh, yeah.
My man.
Thank you.
Let's pick these up. Hold them right there. Man, these are fresh, dude.
Hey.
Are you seeing this guy?
You know he comes clean.
Oh, goodness.
You know he comes 100%.
I'm nowhere near that level.
Just for the doc, man.
Dude,
Wow.
Wow.
Yep.
Making me feel special today, bro.
That's right.
Let's have you on your side. Face me this way to your left.
You know we're all about that shoe and sock game in here.
Oh,
That's right.
All of that
100%.
shoe and sock game, dude. I'm rocking Christmas socks for the
Oh, you already know.
in the middle of November. Okay. Hold that right there, boss. I'm gonna push here and here. Okay, bear with me. I'm gonna push. Good. You all right?
Yeah.
Let's get the other side.
Got the snot out of me.
Dude. Hopefully, make it the Joe Rogans this time around.
That's right.
Damn. So what's up, man? Talk to me about the day you met McGregor.
McGregor, yeah, it was a UFC 197 press conference.
Wow.
And,
I'm just gonna talk to you.
dude,
Face up. USC 1.
UFC 178 press conference.
Okay.
And he was fighting Dustin Poirier for the first time.
Okay.
And so I happened to get into the pit where you ask questions.
Yeah.
And it was my turn, and I just wanted to compliment his suit. And, you know, it was nice, and I asked him if that's where he got his confidence from. And then he said one of the most quoted things ever that, you know, still plays to this day, and that's, nobody, you know, dresses like me, yada, yada.
Yeah.
And then so I just decided to ask him, well, you know, what about the suit that I'm wearing? And he's like, nah, you know, to be honest, it's clashing, you know, it doesn't look really good.
Yeah.
But John Jones was ragging me harder than Connor, and so I was like, all right, cool.
Yeah.
So after that, I was inspired to kind of make fun of Connor. So then I started doing parodies, and it worked out for a while until.
Dude, it's funny. I saw one of your videos where like you were kind of like imitating him.
Yeah.
And then like even your beard was.
I dyed the whole thing, man.
It was dyed and
Yeah, I
everything.
dyed it orange and everything.
Yeah, dude.
Yeah.
How was that? Like that whole.
It was a crazy experience, man. You know, we did so much because I had a partner that was helping me film, and like he would get a lot of the contacts and connections that we had.
Yeah.
And we'd reach out to a lot of people. So anyway, when we went to Vegas for UFC 202, it was weird. It was a weird experience to have fans that were following me and just like people like, dude, I saw your stuff. You're funny, dude. Let me buy you a drink. So we got drunk in Vegas for free, man. Like people took care of us. It was crazy.
That's funny.
Yeah,
man.
it was awesome, man.
Now, did you get to meet other? Ooh, good. And one more. Good. Did you get to meet other fighters too along the way because of all that?
I
Let me hook
did.
you up.
Yeah. Oh, thank you. I did actually. I felt like because of that experience, people like Nate Diaz, he actually reached out to me. He thought the stuff that I was doing was funny.
I saw a video
Yeah.
when you went in. You're
Yeah.
like, "Yo, Nate, like, take a picture with me."
Right? Yeah. I was actually waiting for him. He was taking pictures with some fans, and then I was like, yeah, let me see if he actually like recognizes me. And sure enough, when I went up to him, he was like, "Dude, you're funny, dude."
Yeah,
What's up?"
I
So,
saw
like,
that
yeah,
video. That
thank
was
you,
crazy, man.
I appreciate that. Thank
Yeah,
you.
so you got to meet a lot of cool people along
I
the way.
did. I did.
Yeah.
Yeah.
That's pretty awesome, man.
Thank you, man.
Dude, how do you feel? You feel good?
I feel good.
Good.
Yeah, I that was rough at first, but like right now I feel really
Dude,
energized.
it's horrible.
Yeah.
But like I always like to like really stress that like I'm not here to really show you a good time. Like I'm here to make you functional, make
Yeah.
you perform, right? And like although I had to really dig in there
Yeah.
and you hated me for a couple seconds, man, you'll be more loose and more mobile. But
Yeah.
some take home points, man, is that the point of this whole thing is to get sustainability.
Mm-hmm.
You wanna like, all right, man, you don't wanna feel that anymore. You don't wanna like go back and revert back to how you were.
Right.
So take home points is you have to put some heat on that, dude.
Okay.
Heat increases vasodilation, which is more blood flow. More blood flow equals more mobility, which means that it's less stiff. So you want to always put heat, and you always want to use a lacrosse ball, man. Bang that thing against the wall, put in the shoulder blade, and just go back and forth, man. That's going to help you maintain all the mobility work that you do outside of regular home. Like you come here, I knock down a mean elbow, I scrape, I loosen you up, I adjust you, and the point is for you to sustain that. So don't fall off man, every single day.
Yeah.
Yeah, man, for sure.
Good, man.